I'm Kelechi Uduhiri. I'm a family physician on faculty at the Franklin Square Family Medicine Residency Program and also the Medical Director of Healthcare for the Homeless in Baltimore County.
And what drew you to family medicine?
What drew me to family medicine was the compassion and the level and quality of care that family physicians bring to their patients and their families. As a young child, I grew up having a family physician who made home visits to our home and was able to take care of the minor illnesses of myself and my siblings, as well as complicated medical problems in my parents. So from a very young age, I knew that a family doctor is what I wanted to be.
And as a family physician now, what are the satisfactions? What keeps you going?
I think what keeps me going is the trust that my patients have come to have on me, and being able to have someone that they can call at any time for advice, for concerns, where other specialists may have sort of not been able to meet those needs. So the willingness, ability, and comfort level that your patients and the trust that they build with you is, to me, the most exciting part of family medicine. It just keeps me going on a daily basis. And on one day, we may be dealing with so many various issues, and being the person that can really decipher, that can really help them get through the system, that can really help them explain so many different things that are complex in medicine, that relationship and that trust that you build with your patients it's incredible, invaluable, and it keeps me going on a daily basis.
So how would you describe the kind of problem solving that medical decision making that physicians do, that family physicians do?
It's complex because it usually involves not just the medical aspect of the patient's problem, but the psychosocial aspect of the patient's lives. So we bring in both entities. We can explain medical knowledge, but as it applies to the patient, so every patient is different, not one size fits all. A particular problem that a patient may be experiencing will vary from patient to patient. So as family physicians, we have the benefit of not just the medical knowledge and medical expertise on a wide range of medical problems, but also that extra knowing your patient, knowing their families, where they work, where they live, and what impacts their life and what matters to them. Knowing that piece and putting in the medical knowledge together really helps us be key gatekeepers, essentially, and helping our patients decipher what's best for them and for their families.
So anything else, if you were speaking to students right now, or somebody who's considering going to medical school, what would you tell them about a career in family medicine?
I think a career in family medicine is extremely exciting. Just the opportunity to really work with so many other physicians who are dedicated to wellness, who are dedicated to what's best for their patients, who are dedicated to improving the overall health of the community. So you're not just dealing with the health of your patient, but how it overall impacts the health of the community. And to work with the experts in that field, and on a daily basis, you're dealing with so many different problems. One minute you're dealing with a newborn, another minute you're dealing with an adolescent, another minute you're dealing with a woman who's just had a baby, another minute you might be dealing with their elderly parents who's aging, needs to go to hospice. So it's so variable, and it's a very unique profession because you're not only working with the patient, but also with their families in the context of the community.
So you got a master's in public health.
Yes.
So how does that play into your work as a family physician?
I think a degree in public health broadens your perspective on primary care. So with family medicine or with traditional primary care, we're focused on what happens in the clinic. But in public health, you really think outside the box.